There has been an explosion of information regarding low testosterone levels in the past several years. It is important to realize that not every man, even with what is considered low testosterone, needs to replace the hormone. The issue is whether or not a man is symptomatic. Hi, Dr. Brian here, retired physician, former medical director of the Oklahoma Men's Clinic, and founder of Health Without Risk. It is not enough to tell your doctor that you are more tired than you used to be. There is a questionnaire with the acronym ADAM that is an indicator of symptomatic testosterone deficiency. ADAM stands for androgen deficiency in the aging male. Most of you think of erectile dysfunction as a symptom of low testosterone, and that may or may not be true. The development of ED is actually somewhat predictive as the first symptom of future cardiovascular disease, the #1 cause of death in the United States. Erectile dysfunction usually is caused from inadequate blood flow to the genitals to achieve or maintain an erection. Atherosclerosis, high blood pressure, and insulin resistance play an important role in addition to testosterone. Some of the more common symptoms of low testosterone include loss of muscle mass, midsection weight gain, loss of sex drive, and not being able to think as clearly or as organized as you did in the past. Most men are screened only for total testosterone levels, and if they're in the normal range, even symptomatic men may be dismissed as not needing testosterone replacement. However, the total testosterone for that particular man, if he is symptomatic, may be less than optimal for him. More important than total testosterone is the free testosterone level, which is the amount of hormone available for binding with testosterone receptors. Bound testosterone to sex hormone binding globulin is not available for receptor interaction. Only free testosterone is available for use. It is extremely important to monitor men who elect to undergo testosterone replacement. Lab tests should be done fairly frequently. We do them every 3 months the first year, and if stable, may be done less often, let's say twice a year. This includes measuring blood counts to check for escalating hematocrit levels and prostate-specific antigen to screen for prostate cancer. Evidence does not indicate that testosterone causes prostate cancer, but it is strong that it will grow a small prostate cancer that's already developed. Blood clotting and heart attack rates can increase in men on testosterone whose bone marrow produces a significant increase in red blood cells. You make about 2 million a minute. This blood clotting risk can be reduced by donating blood every 2 to 3 months and keeping hematocrit levels below 52%. The benefits of testosterone replacement include improved sex drive, firmer erections, increased muscle mass, less insulin resistance, weight loss, better mental clarity, and better bone mass. If a man has no symptoms, then testosterone replacement is not really indicated. If you have these symptoms, take the ADAM questionnaire and advocate to have your free and total testosterone levels measured. If your doctor won't do them, send an email and I'll show you how to order them yourself, or go to my Zap bio link on the profile page and scroll down to Rupa Health and order the TRT monitoring male testing from Access Labs. Like and share this video, and don't forget to subscribe to and follow Health Without Risk, where we explore options for better health you won't get from mainstream medicine. Have a great day, and thanks for watching. Bye.